Well, SuperPath hip replacement is a way of doing hip replacement which is slightly different from the standard operation. In a standard operation, the cut is bigger and you do a lot more soft tissue damage, especially the tissues at the back of the hip in a posterior approach or front of the hip if you're going through the front, to take the capsule, muscles, tendons away to dislocate the hip and then perform the operation of putting new metalwork in and putting it together. In a hip replacement surgery, what's different is you're going through a much smaller incision with tissues largely spread rather than cut, and that means tissue damage is less, pain is less, recovery is quicker, and stability is better. And that is why SuperPath is different from a standard technique. So as you heard earlier, SuperPath hip replacement is less invasive, so it means less pain and quicker recovery. But how do you measure it? So we actually have surveyed our patients, about 800 of them, and looked at their outcomes in terms of how quickly somebody gets back to doing activities. And there are simple things like, when do you give up your crutches after the operation? When do you go back to being able to tie your shoelaces? When do you drive? When do you go back to your work? When do you walk as much as you did before? And the answer for most of them is that you are about 4 or 5 weeks ahead of a standard operation. So 80% of the patients will give up their crutches within 2 weeks. Most patients are able to tie their shoelaces by 4 weeks. 80% of patients are driving at 4 weeks. And most patients are able to walk the same distance they did before a year before their surgery by end of 6 weeks. So in terms of getting back to mobility and function, SuperPath provides a huge advantage by minimizing soft tissue damage to the structures around the hip, and that gives a huge benefit and advantage over standard techniques with this surgery. So with the SuperPath hip replacement, because you're going through a smaller incision and spreading the tissues rather than cutting them, the incision needs to be precisely planned. But before that, the patient's X-ray needs to be templated. So we need to know what is going to be implanted and where and how big and what sizes. And so we have a lot of groundwork preparation. The second thing is then to place the incision precisely on the patient and spreading the tissues. And then there are special jigs which are provided by the company called Microport, who makes the SuperPath hip replacement, to place implants precisely where they should be put in. And at the end of the operation, most patients will have X-ray, usually the next day, to confirm that everything is exactly as it should be. So SuperPath hip replacement has a specific technological parts that allow us to do the operation safely by having perfect view, but using equipment that allows us to put the metalwork correctly every single time. So most patients can have SuperPath hip replacement. There are some times when SuperPath is not appropriate, and that is the case for all surgeries, including hip surgery. When you have a very complex job, you need better access. You need more access, more soft tissue releases to be able to see and do the job. And in those cases, doing it through smaller hole doesn't work very well. So there are limitations in terms of complex patients that we cannot do it through the SuperPath technique. But otherwise, majority of the patients, SuperPath technique is possible. So if you look at long-term outcomes, I think hip replacement in general provides excellent improvement in quality of life and benefit. SuperPath is no exception. But if you want to measure the difference between SuperPath patients and a standard patients, I think, to be perfectly honest with you, at 1 year or beyond, the difference is very little. Most of the difference that you will see with minimally invasive SuperPath hip replacement is actually early. Patients can get up and walk early, give up their walking aids early, get back to work and sport early, and be fit and back to doing most activities that they love doing without any restrictions early. And it is the lack of restrictions and quickness of recovery that are specific to the minimally invasive surgery. But at long term, I think most hip replacements behave the same way, and SuperPath does the same as most other operations.